Well, it's March 11th, 2025.
Mm-hmm.
And you know what that means.
5 years. 5 years since the WHO declared COVID-19 a global pandemic.
The WHO declaration really focused global attention on just how serious this was, how big this crisis was becoming, and the need for a coordinated response.
And I think for anyone listening, try to remember that time. All the uncertainty. I mean, beyond the immediate fear of the virus itself, there were all these questions about how essential health services, the things we usually just take for granted, how would they continue?
Right.
Like routine immunizations for kids.
Right, exactly. And so for our deep dive today, we're looking at a really interesting example of how one organization, the Geneva Learning Foundation, we call them TGLF, they saw this challenge. And with some support from the Gates Foundation, they did something unique. They created the COVID-19 Peer Hub. It connected health workers across their network so they could learn from each other and support each other in those really, really difficult early months.
So today we're going to explore how this peer-to-peer learning network was even set up, how it worked on a daily basis, what they actually achieved during this crisis, and really importantly, what lessons it might have for how we get ready for and respond to future global health emergencies. And to help us unpack all this, we've got some great material. We'll be looking at articles by Rita Sadki and a project report that goes into detail about this Peer Hub.
Yeah, let's unpack this. Early 2020, global anxiety was incredibly high. As COVID spread, and it spread fast, threatening to overwhelm health systems everywhere, there was real concern about the impact on other essential public health programs. Routine immunizations, like measles and polio, they were at risk, especially in countries with weaker health systems. And then the reports started coming in. Health workers afraid to go to work, being stigmatized, excluded in their own communities. And then there were shortages of vaccines and other vital supplies.
Yeah, it was a huge problem. And it's important to remember these weren't just like theoretical problems. They were real threats to decades of progress in protecting people from preventable diseases. Imagine, you disrupt routine immunization, you could end up with secondary outbreaks. On top of the pandemic, it was a situation that needed innovation, adaptable solutions, fast.
And that's where TGLF came in. And they weren't just some new organization that popped up. They had been building these digital peer learning programs for immunization staff since 2016. And in their first 4 years, they'd already connected something like 15,000 people, mostly in West and Central Africa. And importantly, they were reaching the frontline health workers, at the lower levels of these health systems.
And their approach was different, you see. They focused on peer learning. They consciously designed their model as an alternative to those top-down training approaches, the ones that are so common in global health. In those more traditional systems, knowledge comes from a small group of experts and is passed down.
Right, like a trickle-down kind of thing.
Yeah, exactly.
But then the pandemic hit, and it really showed the weaknesses of that system. When you have something new, something rapidly changing, it doesn't work as well. Health workers on the ground were facing problems no one had ever seen before. Issues that weren't in any existing guidelines. They needed to be creative to come up with solutions that worked in their specific communities. They couldn't wait for instructions to come from the top.
Right. No one, no matter how expert they were, could have predicted every challenge those frontline workers would face. How do you reach isolated communities in lockdown? How do you deal with the fear and misinformation about the virus? They needed a different kind of learning, one where they could connect with and learn from each other directly and in real time.
And that need, that urgent need, led to the COVID-19 Peer Hub. It was an 8-month project designed around what's called challenge-based learning. So the core idea here was to recognize that the participants, the health workers, they were the experts in their own local contexts.
Right.
They weren't just there to passively receive information. They were creating knowledge, working together to find solutions to the problems they faced every day.
And it's subtle, but it's a really important shift in power. TGLF's approach valued the experience of those frontline workers. It recognized that their perspectives were important, and it gave them the power to share their knowledge with peers across borders and across different levels of the health system.
So how did this Peer Hub actually work? In practice, I mean.
Well, first of all, the participation was huge. Over 6,000 health workers joined. And within the first 10 days, they share over 1,200 ideas and practices for dealing with the pandemic in their own communities. This all happened through what they called an ideas engine. It was an online platform, a tool for managing all these innovations.
That's incredible. Over 1,200 ideas in 10 days. What kinds of challenges were they focused on?
It was a broad range, everything from how to restore confidence in routine vaccinations, because that had dropped because of the pandemic, to keeping health workers safe because they were on the front lines facing a lot of risk. They talked about planning catch-up vaccination campaigns, changing how they ran those campaigns to fit the new reality, how to respond to outbreaks, how to deal with staffing shortages, and how to manage supply chains that were being disrupted.
It really does sound like a real-time problem-solving network. What happened next?
Building on all those shared ideas, the participants then developed about 700 action plans. And these action plans were directly based on what had been shared through the ideas engine. And there was a really key element here, peer review. Before these action plans were finalized and put into practice, they were reviewed by other participants in the peer hub. That feedback from peers was super valuable. It helped to improve the plans and make sure they'd work in different contexts.
So it wasn't just a brainstorming session. There was a system to make sure the ideas were good and could be implemented.
Exactly.
What about support? Did the health workers just go and implement these plans on their own?
No, there was more support. They had something called the Impact Accelerator Launchpad. It was a 4-week program designed to give the participants more guidance and resources to help them actually put their action plans into practice. It helped them to overcome the obstacles that always come up when you're implementing something new in the real world.
And it wasn't just about these broad action plans, was it? For our listeners to really grasp the scope of this, there was also a focus on vaccine hesitancy, right?
Right, absolutely. There were a lot of understandable concerns about the new COVID vaccines. So the Peer Hub helped to create 734 peer-reviewed case studies. In these case studies, participants wrote about their own experiences in talking to people who were hesitant about vaccines and how they helped them overcome their concerns. It was a rich collection of qualitative data from many different frontline perspectives that offered some really valuable insights into how to communicate effectively and engage with communities.
What were the main outcomes? What did they learn from this whole initiative?
Well, one of the most important things they achieved was the creation of what they called a human knowledge and action network. It wasn't just a website, it was a network. A network formed through both the formal activities like the ideas engine and the action plans, and through the informal connections and social learning that happened between all the participants. And that really highlights the power of connecting people, of sharing experiences when you're trying to face a global crisis.
And the analysis of the action plans, it showed something interesting about how knowledge was being shared.
Right, yes, it did. When they looked at how those ideas from the ideas engine were used in the action plans, they saw a lot of cross-pollination of knowledge. People weren't just sharing ideas within their own country or organization. There was a lot of exchange between people from different countries, different organizations, and different levels of the health system. For example, around 2/3 of the ideas cited in the action plans came from people working at a different level of the immunization system than the person who wrote the plan. So an idea from a local clinic in one country could be influencing a national policy in another country.
That's amazing. It really shows how valuable it is to have diverse perspectives and how powerful a connected network can be. And this wasn't just a small project, was it?
No, it wasn't. The use of TGLF's digital learning platform doubled in the first 6 months of the pandemic to 30,000 users. And by 2022, it had reached 45,000. That kind of growth shows that there's a real need for this peer-to-peer learning in global health.
So what did the participants think about being part of the Peer Hub? Their own words really helped to understand the impact.
The feedback was overwhelmingly positive. They talked about feeling more motivated and encouraged because they were part of this network. They valued the opportunity to learn from the experiences of their peers in other countries, and they felt more confident about implementing their action plans. One participant mentioned that it motivated them to reorganize their entire district's approach and to invite immunization officers to learn from the Peer Hub, which led to direct improvements in their immunization sessions.
It wasn't just about information then. There was a real sense of community and purpose that drove action.
Exactly. And the project report emphasized that these kinds of distributed learning models have a huge potential for supporting rapid innovation and knowledge sharing in response to all sorts of big societal challenges, like pandemics. Plus, pulse surveys throughout the Peer Hub showed that engagement was high and that participants wanted to stay connected even after the project ended. Over 72% said that their contact with other participants was helpful in their work.
It seems like the people who were most engaged with the peer learning got the most out of it.
That's right. The report highlighted that the participants who took part in a wider range of activities, sharing ideas, reviewing plans, taking part in discussions, they were the ones who were most likely to complete the program. And when they analyzed the Impact Accelerator projects, they found that the more someone connected with their peers, the more likely they were to actually implement their project. Whether they were asking for advice, discussing collaboration, or just sharing their experiences, those who connected with others had a 30% higher implementation rate.
This really challenges how we usually think about expertise in global health, doesn't it?
Mm.
It's not just about the top experts telling everyone what to do.
Yeah. TGLF's approach really pushes back against those traditional hierarchical models. It asks us to rethink who the real experts are and how valuable self-reported data can be when it's reviewed by peers. It makes us question where knowledge comes from and how we can best use that collective intelligence, especially during a crisis.
So looking ahead, what does TGLF's experience with the COVID-19 Peer Hub tell us about preparing for future pandemics and the role of these learning networks?
I think it shows, without a doubt, that these connected transnational digital networks can be a vital part of pandemic preparedness. The way they were able to mobilize knowledge, share ideas, and develop local solutions so quickly, it really shows how effective this kind of collaboration can be.
And they came up with this idea of a full learning cycle, right?
Yeah, right, they did. And it's an important concept. It's basically the whole process, from learning new knowledge to putting it into practice to getting feedback and making improvements. And it was really effective during the pandemic, much more dynamic and responsive than traditional training programs.
It seems like this approach made a real difference on the ground.
It did. By January 2021, just under a year after the pandemic was declared, over a third of the Peer Hub members had implemented their immunization service recovery projects, and they did it faster than their colleagues who didn't have the support of the network.
And there are some great examples of how these networks continued to be helpful even after the initial crisis phase of the pandemic had passed.
Oh, definitely. In countries like Ghana, Burkina Faso, and the Democratic Republic of Congo, the TGLF alumni networks have become valuable resources for their national health authorities. They're now being called upon to help with all sorts of health challenges, not just COVID-19. That shows how powerful it is to build these connections and empower local expertise. For instance, in Burkina Faso, the National Immunization Program Manager actually entrusted a really delicate masked vaccination campaign in conflict zones to the TGLF alumni team. They knew that they had a unique network and that they were great at adapting and coordinating. And in the DRC, the TGLF alumni are increasingly being asked to help the National Immunization Program because they're so good at connecting and coordinating, even for new threats like monkeypox.
It's fascinating to see how TGLF's model fits in with existing theories of learning.
Yes, it really does. It aligns very well with what's called praxis learning theory, which emphasizes the importance of learning by doing. It says that learning is most effective when it's linked to action, when theory and practice are combined through collaboration. And the theory suggests that scale can actually make learning better, and that a good structure is essential for effective peer learning and knowledge creation.
So, what do you think is the biggest challenge for this kind of collective intelligence approach? What's stopping it from being even more widely accepted in global health?
Well, both the project report and Sadki's articles point to the same thing. The difficulty of being taken seriously in a system that still values traditional academic publications and expert opinions more highly. There's sometimes skepticism towards knowledge that comes from networks of practitioners rather than from academics. But there's a growing argument that as we learn more about collective intelligence, as the methods and technologies get better, it will become more accepted. It has to, really, because it's going to be essential for dealing with complex and rapidly changing problems like global health crises.
So to wrap up our deep dive today, I think the story of the COVID-19 Peer Hub is a really powerful example of how a quick, networked response can give frontline health workers the tools they need. They're the ones who really understand their communities, and this approach allowed them to share their knowledge, to innovate, and to adapt in the face of this unprecedented crisis.
It definitely highlights the limitations of those top-down models, especially when things are changing so fast and you need people to adapt to their local situation. The Peer Hub shows us that peer-to-peer learning is incredibly powerful. It helps people find creative, tailored solutions, but it also creates a sense of community, a shared purpose, and a solidarity among health workers who are often under immense pressure.
And today, as we remember that day 5 years ago when the WHO declared the pandemic, the lessons from the COVID-19 Peer Hub are more important than ever. They remind us that we need to invest in and develop these networked approaches. We need to be prepared for the next health challenge. We need to recognize the expertise that exists in communities all over the world and the amazing potential of collective intelligence.
I completely agree, and I think this deep dive leaves us with some important questions to think about. First, how can we use digital networks better to make learning faster, to improve collaboration, and to encourage innovation in global health? Not just during emergencies, but all the time. And second, what can we do to make sure these collective intelligence approaches are seen as legitimate and are integrated into our health systems and knowledge sharing structures? Because the world is only getting more complex and we're going to face more unexpected health challenges. These questions are crucial as we move forward.
Well, that's all the time we have for our deep dive today. We hope you found it informative and thought-provoking. Stay tuned for more deep dives in the coming weeks.
Thanks for listening.